Now let me discuss the other group of anti-anginal drugs, that is your partial fatty acid oxidase inhibitors. Now we have the important drug in this partial fatty acid oxidation inhibitors, that includes trimetazidine. This is the very important anti-anginal drug. Now let me tell you the mechanism of action of these particular trimetazidine. Normally what will happen is, if you take our heart, normally the heart will utilize the fatty acids as a source of energy. Right? Normally the heart will utilize the fatty acids as fuel, right, for its requirement. But the problem here is, these fatty acids, they are not efficient fuels. Right? They are not efficient fuel for the heart. So now what you try to do is, you try to divert the heart, instead of utilizing the fatty acid, you divert the heart to utilize the glucose. Okay, so with the help of this trimetazidine, what you do is, you inhibit this fatty acid oxidase. Right? This trimetazidine will inhibit the fatty acid oxidase. So when this trimetazidine is inhibiting this fatty acid oxidation, or this trimetazidine, it will inhibit the oxidation of the fatty acids. Right? This trimetazidine is inhibiting the oxidation of the fatty acids. So when trimetazidine is inhibiting the oxidation of the fatty acids, there is no energy production from your fatty acids. Only and only when the fatty acids undergo oxidation, then the fuel or the energy is released from your fatty acids. But when you are using a substance and inhibiting their fatty acid oxidation, there is no energy production from that fatty acids. Now what the heart will try to do, heart will start utilizing the energy from the glucose. Right? Heart will start utilizing the energy from the glucose. And remember a point here, glucose, it is a very efficient fuel for the heart. Right? Glucose, it is a very efficient fuel. Right? Glucose, it is a very efficient fuel for the heart as a source of energy. Right? So with the help of this trimetazidine, if oxidation of the fatty acids is inhibited, then the heart will try to start utilizing its energy from the glucose. Now the other important advantage of your trimetazidine is, now what is your trimetazidine doing? Trimetazidine, it is inhibiting the oxidation of the fatty acids. So by inhibiting this fatty acid oxidation, that is trimetazidine, it is also inhibiting the lipid peroxidation. Right? It is also inhibiting the lipid peroxidation. So when this trimetazidine is inhibiting the lipid peroxidation, this will reduce, right? This will reduce the generation of the free radicals. Right? This will reduce the generation of the free radicals. Now what is the advantage of this? Remember, whenever there is reduction of the free radical production, thereby the myocardium, it gets protected from the harmful effects of the ischemia. I'll repeat again, this trimetazidine, it is not only inhibiting the fatty acid oxidation, it also inhibits the lipid peroxidation. When it is inhibiting the lipid peroxidation, there is no generation of the free radicals. When there is no generation of the free radicals, the myocardium, it gets protected from the harmful effects of ischemia, right? Thus, this trimetazidine, it can provide the beneficial effect in angina via non-hemodynamic mechanisms. If you take the nitrates, you take the beta blockers, you take the calcium channel blockers, they were giving the beneficial effect via the hemodynamic mechanisms, whereas the trimetazidine, it is providing the beneficial effect in angina via non-hemodynamic mechanisms. Now, we have another important drug which is used as the partial fatty acid oxidation enzyme inhibitor, or it is used as a partial fatty acid oxidase inhibitor. One drug what we have discussed was the trimetazidine. The other drug what we have is ranolazine. The other drug what we have is the ranolazine. Ranolazine was initially assigned to this group. However, now it is believed that it acts by blocking the late sodium current that facilitates the calcium entry is the mechanism of action of your ranolazine. Previously, ranolazine was also under the group of your partial fatty acid oxidation inhibitor, but now it is believed that it acts by blocking the late sodium current that facilitates the calcium entry. Now, remember that it is approved as the first line agent for chronic angina. Right? This is used for chronic angina, not for your acute angina. And let me tell you an important point here. You take your beta blockers, you take your calcium channel blockers. They were having the effect on the heart rate, they were having the effect on the blood pressure. Whereas you take ranolazine. Ranolazine, it has no effect, right? No effect on heart rate and as well as the blood pressure of the individual. And it has also been shown that in clinical trials to prolong the exercise duration of the individual and time to angina. It is used as both as monotherapy and when administered with conventional anti-anginal therapy. Alright, so these are the few points about the ranolazine. Ranolazine, it is used in, or it is a first line agent in chronic angina. It has no effect on the heart rate of the individual or the blood pressure of the individual. Now, we have discussed one important point that whenever we are giving this particular nitrates, you should not give the phosphodiesterase inhibitors like sildenafil. Whereas ranolazine, whenever you are giving this ranolazine, it is very much safe, right? It is very much safe to use this sildenafil. Right? It is very much safe to use this particular drugs, that is sildenafil, which is used in erectile dysfunction. What did we discuss? We cannot give this particular sildenafil or phosphodiesterase inhibitors whenever we are giving these nitrates. Why? Because the individual will have increase in the cyclic GMP levels that will cause severe hypotension. So that is the reason why sildenafil should not be given whenever you are giving nitrates. But you can give safely whenever you are giving this ranolazine. But one important precaution what you have to remember about your ranolazine is that ranolazine, it will increase the QT prolongation. It will increase the QT prolongation. Now, what is your QT prolongation? Your QT prolongation is nothing but the QT interval in your ECG. For example, you see here, this is the P wave, this is the Q, this is R, S, and then followed by that you have the T wave, right? So this is P, this is Q, R, S and T. Starting from Q wave to the end of T wave, this is called QT interval. Your ranolazine will increase this particular the QT interval. So that is the reason why it is contraindicated in patients with existing QT interval. This is a very, very important point. This ranolazine is contraindicated in patients with existing QT interval. Now, what is the disadvantage? So when QT interval is prolonged, what is the problem? Remember, those individuals who have QT prolongation, they are having high risk of developing arrhythmias. So that is the reason why the QT prolongation is a very important thing in the ECG, what we have to take utmost care to prevent the development of the arrhythmias, right? Next, ranolazine should not be given in those individuals where they have already existing QT prolongation. The other point is ranolazine, it should not be given along with those drugs which will increase the QT interval. Now, what are those drugs which will increase the QT interval is? Right? If you see the drugs which will increase the QT prolongation, these drugs include number 1, class 1 antiarrhythmic drugs, number 2, class 3 antiarrhythmic drugs, right? Example like quinidine, dofetilide, sotalol. These drugs will increase the QT interval. So ranolazine should not be given along with those drugs which will increase the QT interval. Next, the other important point about the ranolazine is it can also decrease the occurrence of atrial fibrillation. Right? The other important point about ranolazine is ranolazine, it also decreases the occurrence of atrial fibrillation. That is one advantage. The other important point about the ranolazine is it also decreases the HbA1c levels. HbA1c, it stands for glycosylated hemoglobin, and HbA1c tells you about the long-term glucose status, right? And your ranolazine will cause a small decrease in your HbA1c. Now, let me tell you a very important point. This ranolazine, number 1, it is contraindicated in those individuals who have already pre-existing QT prolongation, and it should not be given along with those drugs which will cause QT prolongation. The other important point is this ranolazine, it is contraindicated in patients with significant liver and kidney disease, right? So those individuals who have significant liver and kidney disease, this ranolazine is contraindicated. And remember, ranolazine is not to be used for the treatment of acute anginal episodes. Ranolazine is used for chronic angina, not in case of the acute angina, right? So let me shortly revise about this particular ranolazine. So ranolazine, remember, it is the drug which was previously put under the partial fatty acid oxidase inhibitors, and this ranolazine, now it is believed that it is acting by blocking a late sodium current that facilitates the calcium entry. And this ranolazine, it is very much approved as a first line agent for chronic angina, and it has no effect on the heart rate and as well as the blood pressure of the individuals. And in the clinical trials, what it has been shown that it will improve the exercise duration and it will reduce the angina of the individual. And very important point is this ranolazine, it can be given safely in those individuals who are having erectile dysfunction and parallelly taking sildenafil. And this ranolazine, it will cause the QT prolongation. So that is the reason why this ranolazine should not be given in those individuals who are already having a pre-existing QT prolongation, and this should not be given along with those drugs which will cause the QT prolongation, because whenever there is QT prolongation there is a high risk of arrhythmias. And the another important advantage of the ranolazine is it will cause decrease in the incidence or the occurrence of atrial fibrillation, and it will also cause a small decrease in the HbA1c. And whenever the individual is having liver and as well as kidney disease, this ranolazine is contraindicated. And remember, ranolazine is not used for the treatment of acute anginal episodes, it is used in the treatment of your chronic angina.